So to first start talking about the atlanto-occipital joint, or the AO joint for short, as the name clearly suggests, this joint is formed between the occipital bone of the skull, otherwise known as C0, as well as the atlas, or more simply referred to as C1, due to it being the most cranial vertebrae of the entire vertebral column. So the specific articulating surfaces are the two convex occipital condyles that are located on either side lateral to the foramen magnum, and the two concave superior facets located on the lateral masses of C1. Okay. The AO joint has 2 degrees of freedom, which we'll show here. Okay. So we have flexion and extension, which occurs in a sagittal plane about a transverse axis that we can visualize as passing through the external acoustic meatus, or the mastoid process. The other degree of freedom is side flexion, which occurs in the frontal plane about a sagittal axis that we can visualize as passing through the nose. There is also a coupled movement pattern of side flexion plus rotation, and the capsular pattern of restriction seen in this joint is an equal limitation of extension and side flexion. The normative values of range of motion are as follows. There's about 3 to 4 degrees of flexion, about 21 degrees of extension. There's about 5 to 6 degrees of side flexion in either direction, and there's approximately 6.5 to 8 degrees of rotation, with left rotation potentially being on the higher end and right rotation potentially being on the lower end. Also want to note that moving forward into this video, Nicole and I are going to be demonstrating the movements, and they're going to be quite exaggerated compared to what we know they are in real life. Because of course, in real life, these cranial vertebral movements are quite restricted by the supporting structures like the ligaments and the capsules and all those things. But just for the purpose of demonstration, we wanted to show them a bit more magnified in amplitude.
The osteokinematics and the arthrokinematics that occur at the atlanto-occipital joint. So in order for the movement of the bone to occur, so the movement of the skull, there must be a simultaneous motion at the level of the joint surfaces. This ensures that the joint surfaces remain articulated throughout the entire motion. So to discuss flexion first, osteokinematically, the skull rolls forward, and arthrokinematically, the occipital condyles of the skull will glide posteriorly on the superior articular faucets of C1. And for extension, the osteokinematics involves the skull rolling backwards, and arthrokinematically, the occipital condyles glide anteriorly on the superior articular faucets of C1. And to discuss side flexion, you have to remember that it's a coupled movement pattern that occurs with contralateral rotation. So osteokinematically, the head will side flex and rotate in the contralateral direction. And arthrokinematically, we will see that the occipital condyles will glide to the contralateral side. The ipsilateral condyle will be gliding anteriorly, and the contralateral condyle will glide posteriorly. So the anterior and posterior glides of these condyles is what influences the rotation in this movement. About the anatomy of the atlanto-axial joints. So that is an articulation between C1, the atlas, which sits cranial to C2, the axis, which contains the odontoid process, which protrudes superiorly and articulates with C1. The alar ligaments, so there are 2 alar ligaments, connect the odontoid process to the medial aspect of the occipital condyles. They become taut in lateral flexion and rotation. There's also a transverse ligament which wraps around the posterior aspect of the odontoid process, and this keeps the odontoid process articulated against the C1 bony arch and prevents translation of the dens into the spinal canal. So there are three articulations that make up the atlantoaxial joint. There are two lateral articulations, and they are between the inferior articular faucets of C1 and the superior articular faucets of C2, and they are biconvex in adults. There's also the median joint, and there's only one of those, and it is the posterior aspect of C1, bony anterior arch, which is a concave surface articulating with the anterior articular surface of the odontoid process, which is convex. So now to talk about degrees of freedom. There are 2 degrees of freedom involving flexion and extension, and side flexion and rotation. So side flexion and rotation is a coupled movement pattern, meaning that they occur together. So flexion range of motion in this joint is around 11.5 degrees. Extension range of motion is 10.9 degrees. Side flexion range of motion is 4 to 9 degrees, and then rotation is 38 to 39.5 degrees.
If we're talking about flexion of the AA joint, then this occurs in a sagittal plane about a transverse axis that we can visualize as running through the osteoligamentous ring of C1. If we're just talking about the osteokinematic movement, then we can say that C1 as a bony segment in space is going to rotate anteriorly as the head moves into flexion. Now, if we want to describe what movements are going on between the joint surfaces themselves at the same time that the osteokinematic movement of C1 is occurring into anterior rotation, then the inferior facets of C1 will orthokinematically glide anterior-inferiorly. Okay. And for extension, this happens about the same axis and in the same plane as flexion. This time, the osteokinematic movement occurs when C1 rotates posteriorly, while at the same time, the inferior facets of C1 will orthokinematically glide posterior-inferiorly. Yep. And so the takeaway here is about the orthokinematic movements is that they're required in order for the AA joint to achieve its full range of osteokinematic movement into flexion or extension. Side flexion of the AA joint, so it occurs about an axis that we can estimate to run right through the nose. The osteokinematics of this movement are a little less clear-cut than compared to flexion and extension, because we have to consider what happens to the alar ligaments as well. Thus, when the head first starts to side flex, this will initiate tautening of the contralateral alar ligament, which then causes C2 as a bony segment to rotate ipsilaterally to the direction of side flexion. This then leaves C1 in contralateral rotation. As for what's happening between the joint surfaces at the same time that the bones are moving in space, it is believed that an overall lateral glide of C1 on C2 occurs, ipsilateral to the direction of rotation, or of side flexion, sorry. And possibly there may also be another orthokinematic movement that occurs concurrently to this, in which C1 also glides inferiorly on C2, specifically localized to the median atlantoaxial joint. And the key takeaway here is that it's this inferior glide of C1 on C2 that provides some slackening of the alar ligament in order for this osteokinematic side flexion motion to occur. Rotation of the AA joint. This occurs about a vertical axis that runs through the center of the dens. So as the head rotates to one side, C1 as a bony segment in space will pivot around the dens ipsilateral to the direction of rotation, just like that. At the joint level, for this osteokinematic movement to occur, there needs the C1 lateral facets that are located ipsilateral to the direction of rotation will glide posteriorly, while the C1 lateral facets located contralateral to the direction of rotation will glide anteriorly. There is also an overall lateral translation of C1 on C2 that occurs contralateral to the direction of rotation. Lastly, the big takeaway here is that with these osteokinematic and arthrokinematic movements, it demonstrates why it is believed that the coupling pattern of side flexion occurs with contrast rotation in the contralateral direction.